Now, muscles of the pectoral region. The pectoral region has main muscles is the pectoralis major muscle, there is pectoralis minor muscle, there is subclavius muscle, and there is serratus anterior muscle. So first of all, the pectoralis major muscle. It is the largest muscle in this area. The pectoralis major muscle originate from the clavicle and the sternum. The part that originate in the clavicle, this is known as the clavicular head, and that originate from the sternum, this is known as the sternocostal head, and some part originate from the abdomen, this is known as the abdominal head. So pectoralis major has different heads. All the heads converge laterally and insert into the lateral leaf of the humerus. And here there is two different fibers. Here we can see the lower part of the pectoralis major muscle gets upward, and here it gets inserted, and the upper part of the pectoralis major muscle, that is the clavicular end, they run down straight and insert in the lateral leaf of the humerus in the lower part, but this part twisted and go to the upward. This is the pectoralis major muscle. It is very important muscle for the surgery where there is defect in this head neck region. And there is the pectoralis minor muscle. Here we see that pectoralis minor muscle, it originates from the rib. Here we see that is the bony part of the rib, and this muscle originates from this bony part of the rib, but this medial side of the rib is the cartilaginous. The pectoralis major muscle originates from this cartilaginous part, but pectoralis minor muscle originates from this bony part of this is the first rib, second rib, third rib, fourth, fifth. So originate from the third, fourth and fifth rib, and they passes upward and insert in the coracoid process. There is another muscle in here. This is known as the subclavius. It is underneath the clavicle. This is known as the subclavius muscle. It originates from the first rib, in the anterior part of the first rib, then goes upward in the clavicle. Under surface of the clavicle, there is the area of the insertion of this subclavius muscle. This is the subclavius. Another muscle in this region is the serratus anterior. Here we see that there is muscle in the upper rib, upper sixth rib. They originate from this part of this rib, and finally they insert in the medial border of the scapula. Can you remember the medial border? What is the medial border? What is the lateral border of the scapula? Here we can see, here is a scapula, and this scapula is the coracoid process, and this is the right scapula. In here we see that right scapula, it is the anterior part, and we can see here this is the anterior part, and in anatomical position it will be the laterally and it will be the medially. In this border the serratus anterior will insert it. So this bone will place like this in the anatomical position. This part of the bone, the serratus anterior muscle is inserted. So these are the muscle of this pectoral region. Here we see some important structure, that there is a artery. We see this artery in the neck. This artery is known as the subclavian artery, as it passes underneath the clavicle. This is the subclavian artery, and this vein will be the subclavian vein. After passing from this clavicle, they enter into the axilla, and here they name as the axillary artery and axillary vein. And there is, we see some whitish structure. They origin in the neck and they pass through this clavicle along with this vessel. This is the brachial plexus. This brachial plexus has some roots, some trunks, some division, and some cords. We will learn it later. And this important thing is that this artery is here is the subclavian artery, and from here this is the subclavius muscle. From here this artery is named as the axillary artery, and this artery is divided by this muscle. This is the coracoid process, and this is the third, fourth, and fifth rib. From here the muscle originates, that is known as the pectoralis minor muscle. This pectoralis minor muscle divides this axillary artery into the first part, second part, and the third part. The part that is underneath the pectoralis minor muscle is known as the second part. And we see that from here the subclavius muscle originate, and this part up to this part is known as the first part, and from here up to this is the second part. From here up to this is the third part. And how many branches of this thing? It is interesting that this part we see one branch. First part has one branch. In the underneath the pectoralis minor muscle, we see here is one branch and here is another branch. There is two branches. And the third part, we see that here is one branch, here is another branch, here is another branch. There is three branches. The third part has three branches, second part has two branches, and first part has one branch. We will learn the name later. Here we see the vein. Here we see the vein. This vein is also known as the axillary vein. And there are some nerves. We see that there is a nerve. This nerve goes medially, but this is the retracted part of the pectoralis major muscle. If we place this muscle in anatomical position, this nerve will situated in the lateral side, and this nerve will be the medial side. So this nerve, according to the anatomical position, this nerve will name as the medial pectoral nerve, and this nerve will name as lateral pectoral nerve. And interesting thing, there is the medial pectoral nerve pierces the pectoralis minor muscle. Pectoralis minor muscle, and the lateral pectoral nerve supply the pectoralis major muscle, as well as the medial pectoral nerve also supply the pectoralis major muscle. Here we can see all the branches in here. The first part, this is the first part, gives one branch, that is the superior thoracic artery. And the second part, this is in this previous picture it was placed in superiorly, but here it is placed inferiorly. This is the thoracoacromial artery, and this is the lateral thoracic artery. And the third part, it has the three branches. The scapular artery is the anterior circumflex humeral, and the posterior circumflex humeral. These three arteries in the third part of the axillary artery. These are the important structures in this area, and we have to learn all the things one by one. Thank you all.